so here we go. Which structure is most likely affected by this vascular event? A 70-year-old woman with poorly controlled hypertension presents with acute onset of right-sided weakness and facial droop. Neurological examination reveals right hemiplegia and right-sided upper motor neuron facial palsy. Imaging studies demonstrate a small infarct in the left basal ganglia. Okay. And then it's a bunch of brain structures here. So poorly controlled hypertension, acute onset of right-sided weakness and facial droop, right hemiplegia, right upper motor. Okay. Oh, I remember this stuff. Okay. Um, hmm. Oh, I think there's like two pictures where one is upper motor neuron and one is upper and lower motor neuron. Um, Anterior capsule. I don't remember. Okay.
So what's your gut? So sometimes with these questions, you want to pick your
Mhm.
gut answer choice, pick the best, and then kind of learn from it if you can't remember.
Okay. I would maybe go with subthalamic nucleus, but I really don't know. I know what they're talking about.
Sure. All right, so let's look at here.
Yeah.
Posterior
Okay.
limb, acute right sided weakness, facial droop, right hemiplasia right on the right side, and then upper
Okay.
motor neuron right. So left side of the brain, small infarct of the left basal ganglia suggests vascular effect. Posterior limb of the internal capsule, which is a cortical spinal, cortical bulbar tract responsible for motor. So
Okay.
something you just have to learn, right? Factoid, right? But we can
Hmm.
also go through the rest here. Caudate nucleus is motor planning, learning, and memory. So you can have movement disorder like
Oh yeah. Okay.
okay, but not
Mhm.
acute motor deficits like here. Globus pallidus, also basal ganglia.
Okay.
So things like dystonia is what would cause
Okay.
it. Okay, subthalic nucleus, also basal ganglia, right?
Okay.
Hemibolism, that's super specific for subthalamic that they like asking, which is characterized by involuntary large amplitude violent movements of the limb. Okay,
Okay.
thalamus is usually sensory. Um, so thalamus can relate to various sensory motor deficits, but not this. But usually they say that the thalamus is usually going to be more sensory,
Okay.
pain and things like that.